and welcome to The Public Good. This is Deja James from Partnership for the Public Good, or PPG, uniting over 380 partner organizations to make a better Buffalo-Niagara region. Lately, we've been doing a lot of episodes about the federal and national crisis and what we're doing on the local level to address those needs. Another big topic in the federal conversation is carceral justice, and how they're kind of throwing people away and throwing away the key, or even getting them up out of here, out of the country. But today we're here to talk about another local piece of carceral justice reform that we've been working on the community agenda. It's actually been referenced in a past episodes in our Treatment Not Jails episode, and I'll make sure that that is linked in the bio, as well as the description, and on social media for you to be able to reference. But we're here to talk about the updates with the Treatment Not Jails Coalition, and I have representatives of the TNJ Coalition here with me today, and now it is being referenced as the Treatment Court Expansion Act. There's been an update in the New York statewide advocacy around the issue, and I'm so excited to have my guests here today to talk to me a little bit more about the details of the act, as well as the experience of those in the treatment courts right now and why these changes are so necessary. So I'm going to let my guests introduce themselves. I don't know who'd prefer to go first. Actually, Jenny, why don't you go first?
Sure. Hi, my name is Jenny Thurston. I am an MSW intern at PPG, and I am working on expanding treatment courts.
Thank you for having me. My name is Laura Robinson. I'm a licensed mental health clinician and a big advocate for the Treatment Court Expansion Act.
Hi, my name is Tom Culkin. I am a mental health therapist and a very newly licensed social worker, and I do have personal experience with the criminal legal system.
Thank you all so much for joining me today to talk about this topic. You've all been doing this advocacy for a while now, and it's just now gotten on the community agenda for our 2025 process. But why first have you all updated the name from Treatment Not Jails to Treatment Court Expansion Act? And then can you get into the details of what the act will do for those who didn't watch the last episode or who may not be familiar with the act in general? Anybody who wants to take that on?
Well, I know that the head of our coalition, her name is Casey Del Porto. She's a lawyer in New York City. She's great. One of the assembly members told her it'll never get passed with this name, so you should change the name to something a little more palatable to everybody.
Yeah.
I think that a lot of people want to hear, oh, not jail. No, we don't want to hear about not jail. So.
And the reality is, with us working with elected officials on some other issues like community responders or things like that, post bail reform, there has been, some pushback from those in New York State, around New York State, around having a fear that everyone's just being let out of jails or nobody's going to jail and now we're all in more danger or whatever that fear is. A lot of those things have been debunked. Community Responder, if you go check out the report on ppgbuffalo.org, talks a little bit about why those are some untruths. There's some untruths there, but I can understand, especially as we do statewide advocacy, you have to be able to be palatable to multiple audiences, especially to get something as that, large done across the entire state. So I can understand. And it's very, very average and normal, honestly, for acts and bills to kind of change wording, pieces of legislation. That's a part of kind of the negotiating process. But the integrity of the act itself has not changed. Is that correct?
No, the act itself is the same.
Okay.
So
and what's that? Yeah.
Right. So the Treatment Court Expansion Act is really a way to look at this positivity around justice reform, right? So even looking back at Treatment Not Jails, that might have more of like a negative connotation, or like you're saying, it's maybe not as palatable to some. When we look at broadening accessibility, that's essentially what the bill is doing. So when we look at alternatives to incarceration, or if someone who has justice involvement also has a mental diagnosis, substance use disorder, or even any other impairments or disabilities, we're looking to include them in a diversion from jail into community, really receiving real restorative treatment for themselves.
Yeah, and I mean, that's a more permanent solution, right? Because if you're just throwing somebody in jail, they get out a few months later, a few years, however long the term is, have you really dealt with the root cause of some of the issues in their life?
Absolutely.
And I think very much you all are looking at a restorative type of framework to address some of the issues that are going on today. I think also in the community responder report, it talks about, what 911 calls are about. And the majority of 911 calls aren't about any imminent danger. It's someone having a mental health crisis. It's also other silly things like I lost a dog, or there's a cat running down the street, or things like that, right? And so why then are we not treating people who are coming in with issues that aren't necessarily like imminent dangers to others, but more harming to themselves? Why aren't we then treating them in a similar manner of like, okay, what are your issues? How do we deal with them in the long term? Because if we're not addressing that, then what are we really fixing? And to the point of, the sheriff, some of that no new jail campaign that we did before, they wanted a new jail because they're like, we're at capacity, we need a bigger jail. And it's like, should the solution be they just build a bigger building to throw people into, or should we like deal with people's problems?
Right, and do that in a community base where someone actually feels comfortable with services either being accessible in community and outpatient settings, or mobile teams are accessible, ACT teams are accessible. So there's different ways that we can formulate treatment as that alternative. Maybe someone who's been unhoused for such a long time, has had a high volume of recidivism, has never really experienced what treatment is. So we can also define that in so many different ways.
What is your response to, those involved with the system right now, running the system, saying, oh, well, we're trying to put more programs in the prisons, right? And we have all these, restorative programs or workforce programs or different things like that in prison. So it's fine if they go to prison, right? Why are you focusing so much on community-based care versus having care once you're inside the prison system?
Well, they have plenty of programs in prison, and they're all a joke. In school, education is not the priority. In the drug treatment programs, recovery is not the priority. In prison, security is always the number one priority. And I understand why it has to be that way. But programs like substance abuse programs are not going to be effective unless recovery is the priority. So because of the nature of the environment, rehabilitative programs just don't work very well, and staff don't take them very seriously. I was in I was incarcerated for 7 years, and I went to prison with, I think I had 10 months clean, but basically still with a drug problem. And I went to prison in 2013. They put me in a drug treatment program in 2019. And then the counselor sat in the office while myself and the other inmates talked about talked about treatment and things of that nature. And I was lucky that there was a couple inmates running the groups who actually cared about doing the right thing, because a lot of times they don't. But some guys would sit there and they'd be playing cards, they'd be reading a book, doing whatever. And as long as they're not disruptive, nobody cares, but they're not paying any attention. And same with the school. I was a teacher's aide for 2 years, helping guys work towards their GED. And if you didn't want to do any work, that's fine. Just don't be disruptive.
It was more about like satiating and just kind of quelling, keeping things calm. And there really was no focus on the actual mission of rehabilitating someone or anything like that.
Right.
It's kind of just make our day easy.
Yeah.
And we see that often in the court system as well, because we have a lot of folks who make clinical decisions but aren't licensed or don't have a background in that, right? So it's like we want to be able to meet the justice system as treatment providers, as new treatment providers who have been impacted by the system, which again, congratulations.
Thank you.
That's amazing.
Thank you.
And to be able to see that where we can collaborate in that way. So again, expanding that accessibility is being able to also be seen as a social worker or a licensed mental clinician or a peer support specialist and actually be heard and seen by the justice system, and not those suggestions being made by a clerk, for instance, or even a judge. We want to be able to meet folks where they're at, especially for our client base, but also with professionals in the system looking at that and having those conversations. We want to see this be able to be something that is really restorative, that actually can make change in someone's life.
Absolutely. And I would love for you all to talk just a little bit about what the experience of true restorative, rehabilitative treatment is, because I think people have a really large misconception about rehab. They feel, they know like Britney Spears or, celebrity rehabs, right? Or different things like that, right? And they don't really know what does rehab consist of? And what is that experience like? Sophie, who joined us on the last Treatment Not Jail episode, very much explains, like, people falling off the wagon or having, a relapse is a part of the process for a lot of folks. And so what does that realistically look like? Because I think some people feel like, oh, well, if they relapse, then it's not working and we just need to be scared and everybody needs to be in jail, right? So what does that realistically look like, and how can people, how can you guys quell a little bit of people's fears about people being out while they're rehabbing? I don't know if there's a lot of misconceptions around that.
So one thing I want to add is that it's probably easier to get drugs in prison than it is out here on the streets. They're just more expensive. I think that in order for treatment to be effective, it has to be a holistic type of treatment. We have to help the person with all aspects of their life. I mean, if you come in and we get you off drugs, but you still have unaddressed mental health needs, well, that's not going to work. Mm-hmm. Or if, we get you stable, but then we send you out into the streets and you have nowhere to live and no way to put food on the table or in your belly, you're probably going to commit crimes to get food. So we have to address all areas of the patient's life and make sure that they're prepared to move on to the next stage. Because I have to tell you from personal experience, when, after years of drug use, being clean was scary. Like the thought of a new life without my crutch, my coping skill was scary. And I needed a lot of help, and I was very fortunate. I was on bail while my case was proceeding. So I spent time, I got involved with the 12-step program. I was in a rehab, and I had made a lot of changes before I got to prison. If that was not the case, I probably would have had a much harder time in prison. I might still be in prison. My drug problem would have gotten worse, I'm sure. But I think that, treating the whole person and all of the problems there's a lot of different reasons people will use drugs. There are a lot of different reasons people are unstable mentally. And we have to address all the reasons.
Absolutely. Once again, getting back to that root cause issue. Why else are we kind of, advocating for more community-based rehabilitative programs? And why should people not fear that type of system?
So one of the things that has come out as a response to the opioid overdose issues is the creation of a specific opioid court within Buffalo City Court. So there are a couple of specialized courts that we're taking a look at including, like I said, opioid court, drug court is separate, veterans court, and mental health court. So this intervention really helps to prevent the overdoses. I think that the stat was like 10 to 18% of people who have a substance use issue will fatally overdose upon release because they get this so far out of their systems and then come back into the communities, possibly get themselves into a situation where they're desperate or they haven't had the correct treatment to get themselves to a point where they feel stable and possibly end up overdosing on a larger amount of the substance, whichever they are using. So in Buffalo City Court's opioid court, they do a pre-plea model, which is what the Treatment Court Expansion Act asks for. So before you can get into treatment in these other courts, in drug court, you have to plead guilty to a charge. So you have jail time hanging over your head before you can even get access to treatment, whereas there's an already existing model in Buffalo, and that's the opioid courts.
And there's a reason there's a differentiation there. And I think Sophie talked about that a little bit.
Right.
Because who has access to opioids and who is the more affected population from the opioid crisis versus other forms of drugs, crack in the past, marijuana, different things like that. We've seen kind of the demonization of certain drugs versus, oh, yes, this is a mental illness or a disease for this one. But for that one, oh, no, that's just like a sick individual in a different type of way. And so this is really leveling that playing field of saying, no, all of these issues are either mentally health based or an addiction, a disease, and we need to treat them like a human being and figure out what those issues are so that we can really be restorative in a type of way. I love that you're trying to create better access. Yeah.
I'm sorry to interrupt, but I want to
Yeah.
add, you said, what can we do to make people, feel like they don't need to be afraid?
Right.
When people are in a diversion program, it's not like we just say, okay, we'll see you next week.
Okay.
You're on your own. They're monitored, they're heavily monitored. They have sanctions hanging over their head. I think like what Jenny was talking about, like if you plead guilty and you have jail time hanging over your head, you kind of maybe have an attitude like, well, they're just waiting for me to fail. I may as well do it and get it over with. But I mean, if you have maybe some lesser sanctions, I don't know exactly what they are, but you're on a short leash. You're not just on your own wandering around doing whatever you want to do.
Yeah.
When you're in treatment, you're responsible to your treatment providers. You're responsible to the court. So people are monitored, and it's not like people are any more dangerous just because they're trying to get clean. Generally, people who are trying to get clean are probably, I would think, less dangerous than people in active addiction.
And what have you seen for those that are in that pre-plea opioid court system? I don't know if you have any statistics of kind of like some of the success rates or different things like that. But how do you all anticipate this being better for those that are currently experiencing the courts as they are now?
Sure. Go ahead, jump in, Laura, if you have anything else to add. But that's actually one of the issues that I'm kind of coming across, is that the information about the success of the courts, specifically in Erie County, is not publicly accessible. There's really not a lot of data to kind of give a picture of how many people are going into each different diversion and how many people are being successfully discharged, the amount of time that it takes to complete these programs. Like Tom said, they are heavily monitored. So somebody could be in treatment court for up to 5 years when the original charge that they were facing, if they would have pled guilty and did not go to diversion, could have been a year. So they're tracked heavily as they go through this. And
so that's kind of odd to me. Like if they are tracked so heavily and there's, this system in place, why is there not information available? I don't want to, speculate.
Lost also, sorry, not to interrupt.
No, please.
But the data is somewhat lost as well because these courts are ad hoc, right? Mm-hmm. We look at drug court kind of being by law a treatment court, and when we look at mental health court or veterans court or any other diversion part, that's kind of like whatever the discretion of the judge and the coordinator want to create for the expectation in that particular court is as it stands in that particular court. So there's not
uniformity.
There's not a uniform menu. Thank you, Tom.
You're
to
welcome.
Really adhere to. Mm-hmm. So when I have my list of long haulers who have been in mental health court in the city of Buffalo for 10, 11, 12, 13 years, who are looking at a misdemeanor charge, which is up to 6 months in jail, and they keep coming in every week after week, I'm thinking, there could be success in these programs if we actually update this by law, if we actually codify and have these diversion programs by law. But because drug court's the only thing that has an expectation, everything else is rogue. Everything else is kind of made up as it goes. And I think that really can be so harmful when this is such an opportunity for the justice system to look at restorative justice and look at the data or create data that could be looked at as successful.
Well, it's a shame that they have these separate court systems because they kind of saw there needs to be a differentiation here. There's this issue or crisis, but then there's no standardization and it's kind of up to the discretion of judges and it's very subjective. That doesn't add up.
So there are a few court models that currently exist that do show that the outcomes of people who participate are fare much better than people who are put into jails or prisons.
Yeah, absolutely.
So I want to add something. Yeah. Like, one of the misconceptions is that people, people who use drugs or who are mentally ill like what they do and want to continue doing what they do. I know that, like personally me, by the time I was getting in trouble with the law, I did not like the life I was living. I didn't like to use drugs every day. I didn't like to have, mood swings and mental instability. I just didn't know how to live any other way. I had to be shown. I had to be taught how to live clean and how to take my meds every day and how to engage in therapy. Like I had to be shown, and we need to do that with people. We can't just throw somebody in and say, okay, now you can't use any drugs or you're going to go away to prison and we're not going to help you. It doesn't work that way. And you know, another thing is that there's less than half the counties in New York State have a mental health court. Like why? And one of the big things that in the Treatment Court Expansion Act that I think would make huge improvements is that there are no charge exclusions. No matter what you're charged with, you're eligible for court. I was told that I couldn't participate in drug court because I had committed felonies. I was charged with felonies that the state considered violent felonies, and I committed these violent felonies to buy drugs, and I wasn't eligible for drug court. So I think that didn't make a whole lot of sense to me at the time. Still doesn't make a whole lot of sense, but I think that's one of the big changes that this law would allow is no matter what you're charged with, you're eligible.
What is your response to people who don't feel like they want that? Like, oh, if you did something violent, then, oh, you must deserve it and you must just deserve to go to jail. You know, like, what is your response to people?
My response is, do you know how much it costs to incarcerate people? I mean, Erie County spends $250,000 a year. I think the state's a little over $100,000 a year. Rikers Island, New York City is $500,000 a year. It's a lot cheaper to treat people than it is to incarcerate people. And I was writing a paper and I did some research, and there was a study that was done in the 90s, and the guy found that the lifetime cost to society of a career criminal was over $1 million. So that includes things like lost work, things stolen, incarceration, things like that. Like, we have a finite supply of money. We can't just pay to incarcerate everybody that does something wrong because we'll eventually run out of money. And just the financial aspect alone should get some people interested. And, when you look at it, like it's just a lot cheaper to treat people than it is to incarcerate them.
I think a good point to add to that too is that punishment doesn't really change behavior, right? It's based in shame. So when we're throwing people in jail, we're not really addressing all of those things that, you said that you and other people that have experienced things, substance use, need in order to recover.
Well, okay. And then I guess, someone's alternative response may be, well, how much is it to treat somebody and how does that get paid for? Would this be a state-based rehabilitative system? How does that portion of treatment court work?
A lot of that's funded through Medicaid, and a lot of that is federal money. So that's Casey has all the numbers on this, and I don't have them available, but it's I've seen them and I don't remember all of them. I do know one thing, that the Office of Court Administration determined that for every dollar we spend on treatment courts, we save $2.21. So we're more than doubling our money. I'm not sure what it costs to treat somebody, but it's a lot less to incarcerate them. I wish I had better available information.
No problem at all. And I know you all have a lot of resources, and we can link those. But I love that you brought up the fact of Medicaid, right? Because we literally just had an episode with the Healthcare Education Project 2 weeks ago, talking about their advocacy to maintain Medicaid, because there's this threat of $88 billion cut over the next 5 years or so of Medicaid. And a lot of people in the comments were asking, well, what is the full breadth of what Medicaid covers? Are we covering things that are wasteful, or there were questions about that. What is Medicaid being spent on, right? And I didn't even know that you could get rehabilitative services through Medicaid, which is, that's huge. That's a huge thing. And so if we think about a cut of $88 billion over the next, how is that? And we're still on, the tail end of the beginning of a crisis here, of an opioid crisis, of all these things. And we said we want to address them. And even the current administration is saying that they want to help people with this type of thing. How is that, weighing itself out with cuts in Medicaid then? You know what I mean? So I wanted to tie those 2 points together because
very important.
I just think all of the topics we talk about on this show are so iterative and intertangled in a lot of different ways. And so I think it's just very striking for people to realize cuts to Medicaid would then be cuts to this system, and therefore leave people in crisis and maybe even exacerbate the crisis, when we all know we want this to be better for our country and for everyone here. So I'm sorry, I'm just jarred by that connection. I just was, but I didn't know if anybody else had anything else to add about, the rehabilitative process, or this last push of advocacy season is going to be a little over soon for the state. By the end of May, they're pretty much wrapping up. And so what is the last pushes you all are making for the Treatment Court Expansion Act, and how can people be supporting that state bill? You know, I don't know if you have any more advocacy days or sign-on letters or things people can activate with, but let us know.
Absolutely. We have an upcoming advocacy day, May 7th. Just going to put that right into the camera. May 7th in Albany.
Wednesday.
What's that?
Next Wednesday.
Next Wednesday.
All right.
Get ready. It's going to be a full day. We're going to be speaking to everyone in Albany, talking about it, screaming about it from the $1 million staircase, just really encouraging folks to consider what this bill can do and how it can help to really rehabilitate our community and bring our community back and healthier and better.
May I ask what the support has been like so far from elected officials? You don't have to call any names or do anything like that. If you don't want to, you can.
It's a slow but sure process. We increase support every year. I can't make this advocacy day. I couldn't get off for work, but I have been going to them for 3 years, and it seems every year we have more support, more people willing to vote for it, more sponsors. One thing that anybody can do is call your senator, call your assembly member, and say, "Hey, I support the Treatment Court Expansion Act. Please vote for it." I called and did that, and they wanted to know my name and my address. They're writing it all down. They're keeping track of who's supporting them. So, make that call. It makes a difference. It really does.
One of the things that we need to do is to get more of our local electeds on board. A lot of the supporters are in different areas, and so some of the electeds that we've already met with, their feedback was, let's see, why do we really need this in Western New York? And unfortunately, because we don't have access to a lot of that data, one of the things that we're doing at PPG is writing a policy report and gathering community research. So we are looking for stories of people who have engaged in any sort of treatment court, so that we can use what, your experiences or others' experiences, your family's experiences, to help inform why we need this change.
And can I just circle back to the data issue? Is it that it's so ad hoc, it's not being collected at all? Is it a FOIA request issue? Is it a little bit of everything? I'm just wondering, because then it can help us push.
I think it's there. I think it's just that they don't know where to search. If there's just so many numbers, like where do we get the numbers we're interested in?
Yeah.
I think so. Maybe like FOIA requests may help, but you may also be given a mountain of information that you have to sift through to find the relevant.
It's not very
statistics.
Centralized, that type of data.
Right. There is no central, aggregation center where they're keeping track of all the cases in the country or in the state.
Or even our county, which is what we can do. So I think the issue is that it's not publicly available. There's other counties where their information is publicly available, or anything that I've really come across has been state data, and it's been very vague and limited. So they'll have information about how many people were assessed, how many people were accepted in the program, and how many completed that program. But it's all very siloed, because just because this many people were accepted in the program doesn't mean that that many people completing the program is the same year, and they're reporting on a year.
Yeah.
I do have one statistic, and now these numbers aren't exact, but it's something like I think 2022 was the last year they had numbers for. There was over 200,000 arrests in New York State, and I think 400 people have been diverted to mental health court. I think more than that small number might have mental health issues. So why aren't we utilizing these courts more?
Right. And I mean, I think it's up to the discretion of, like you said, officers and different people like that, who are like, you deserve to be in here, you don't, right? And that, decision comes down to a person that may have biases or whatever else going on. And so it's really important, like you all said, to standardize that a little bit more.
Right.
Yeah.
And with standardizing it also comes with, again, the conversation around having the judge and the clinical team or the treatment team really be able to have a relationship. We see too often that clients that are held up for all of these years, sometimes it's almost like the court is like, I'd like to safeguard this person, so I'm going to keep them in my monitoring system so that they actually don't graduate until I feel like they're prepared. But if their treatment provider says, well, they have been adhering to the expectations you have in the court, there's been these amazing milestones in their life that we have shared, obviously with the discretion of the client. We want to celebrate them. We think that they have completed treatment. It's also at the end of the judge to say, okay, I will also complete them. So again, without having kind of a standardized idea, we have some coddling going on in the court system. And I think, again, that's looking at really kind of looking at a client, not necessarily as an adult going through this process, but almost like a child. And it can be hard to watch when an individual is being spoken to like a baby by an individual on the bench who isn't really taking the time to learn about substance use or mental health or disabilities at all, just has the opportunity to lead the court without actually investing in the time to learn about who's really coming into the court, what they're struggling with, and how do we all collaborate to make that better.
Absolutely. I think that's such a wonderful note to possibly end the episode on. I thank you all so much for coming and, you know, kind of expanding further the Treatment Court Expansion Act.
Thank you for having us.
Yeah, absolutely. It's just such an important topic right now. We connected it kind of to the Medicaid issue and some other things. And I think it's important for people to understand, even if they themselves don't have a substance abuse issue or they themselves don't have a mental health issue, to understand that human experience and to understand how we can be doing better to help people more in a more permanent way, because I think that's what everyone would prefer, rather than to just throw someone in jail and, you know, and not solve the actual issue. If people actually do want safer communities, if they want opportunities for everyone, these are the type of initiatives that we need to be supporting. And I just appreciate you all uplifting that for our viewers and our listeners.
Work and will work.
Yes.
I think mental health is not a crime. Substance use is not a crime, period. So.
Period.
Thank you all so much for being on the show today. This has been The Public Good. This is Deja James from Partnership for the Public Good, uniting over 380 organizations to make a better Buffalo Niagara region and country and world. As I keep saying in all of our episodes, it matters to everyone and to all of us. We thank you so much for listening. Make sure you like and subscribe to our YouTube channel, and we will see you again next week. Bye.